So our next speaker will be Dr. Cynthia Comella, who will be going over the career development program, the goals and selection criteria. So I'll let you take it away, Cindy.
Thank you, Sarah. Okay, so I'm going to talk about the career development program of the Dystonia Coalition. The main purpose of this program is to help junior faculty develop careers in dystonia research. So I think it's a very important program. It's to get them started. The focus is really on clinical and translational research in dystonia. The plan is for 1 to 2 awards each year, and again, that depends a lot on the funding. Each award is approximately up to $50,000. Okay. The career development program has certain review criteria, and this is important to keep in mind because these are the elements that we really need, and by which we select the program that's going to be funded. The candidate should have potential and career goals that can be very explicitly described. There should be a research plan with relevance to primary dystonia, and that would include things like the impact it would make on the field, and keep in mind feasibility, a project that is doable. Will the award for this particular person really help in their career development? Another element that we consider. They should have a mentor who has experience in dystonia, ability, as well as a track record. And it's really important to consider the mentorship plan. So not just to mention a mentor, but how is this mentor going to interact with the investigator insofar as furthering their career? The environment, of course, can be local or it can be a collaborative project. And we like to consider use of projects that exploit the incredibly rich data resources that have already been collected by the Dystonia Coalition. This is not required, but again, I would urge those who want to apply for this to really consider what has already been collected. Because again, there are many opportunities using this data. The review committee rotates, and you can see their pictures below. And again, they include representation from the NIH as well as from the Dystonia Medical Research Foundation. Now, the applications need to include a 3 to 4 page research proposal letter. And in this letter, it's an explanation as to how the award will impact the future of your career. It's, so again, a very important element. What will this funding do to move you forward as a clinical or translational investigator in dystonia? What we like to see is the generation of pilot data that can be used for publications or as pilot data for writing a larger independent grant. We like to see networking and collaborations with other established dystonia researchers or other career advancement opportunities. There should be a letter of support and an NIH-style biosketch from a senior mentor. Now, these are the past career development awards, and you can see there have been numerous, and many of these have gone on to develop careers in dystonia and independent funding in dystonia. So again, these awards are intended to let you take the next step, take it to the next level. These are our 3 most recent awards. The award for 2022 is still being considered, still being evaluated. But the three most recent awards, you can see 2 in 2020 and 1 in 2021. And we are very fortunate. Well, first, before I go there, as to who can apply. So any junior investigator interested in dystonia can apply for the career development program. You do not have to be a United States citizen, but you should consider, even though it's not required, being a member of the Dystonia Coalition, but it is not required. When's the next opportunity? Very similar to the pilot programs. The announcements are made once yearly, and the next announcement will be expected in January or February of 2023.